It's a peaceful Tuesday morning. Margaret, age 72, is seated at her kitchen table in Ohio. For the past 9 years, she has stayed with the same Medicare Advantage plan. She adores her family doctor. She trusts her cardiologist deeply, and she has never run into a single issue until this very day. She tears open the envelope. Her fingers start to tremble. Her Medicare Advantage plan is finished, canceled, gone in an instant. She grabs the phone, dials a Medigap insurance carrier, and attempts to move over to original Medicare paired with a supplement plan. And then she hears the sentence no retiree should ever have to receive. I'm very sorry, ma'am. Considering your medical background, we have to turn down your application. Margaret isn't the only one. Today in 2026, close to 3 million older Americans are stuck inside this very same trap. And the majority of them never even knew these rules were on the books. Hello there, my friend. I am Miyu, a senior policy analyst dedicated to helping retirees safeguard their Medicare, their pensions, and the benefits they worked so hard to earn. If you are past 65, if you currently hold a Medicare Advantage plan, or if you've even considered moving back to original Medicare, please remain with me for the next 10 minutes. Because what I'm going to share is not being reported on television. It is hidden inside Medicare.gov, the Kaiser Family Foundation studies, and federal statutes under Title 42 of the U.S. Code. I'll guide you through the precise rule using everyday language. I'll point you to the official paperwork, and I'll hand you 3 straightforward steps to keep yourself safe. But please, stick around to the very last minute, because there is one secret error that 9 out of 10 retirees commit during the annual enrollment period that can permanently shut them out of Medigap coverage. I'll uncover it before we wrap up. Take a slow breath, pick up a pen. Let's get started. Allow me to share Robert's story. Robert is 67 years old. He spent 38 years working as a public school teacher in Florida. He entered retirement healthy, joyful, and full of pride. The moment he turned 65, an insurance representative arrived at his front door carrying a glossy brochure and announced, "Robert, why bother paying for Medigap? Choose this Medicare Advantage plan instead. No premium, free dental care, free vision, even a complimentary gym membership." The offer sounded ideal, so Robert enrolled. He set aside the idea of purchasing a Medigap policy. He told himself, "If I ever want to switch later, I'll handle it during open enrollment." Isn't that what the AEP is designed for? Incorrect. For half a decade, Robert lived comfortably. Then in 2024, doctors diagnosed him with type 2 diabetes. Controllable, treatable, nothing alarming. But near the end of 2025, Robert received a notice. His Medicare Advantage plan was being pulled from his county. He had 63 days to act. Robert remained calm. He figured, "I'll just return to original Medicare and pick up a Medigap Plan N. Simple." He reached out to 3 different insurance providers. Each one asked him identical questions. "Sir, do you have diabetes? Are you taking any prescriptions? Has any physician suggested any procedures within the past 2 years?" Every single one of the 3 carriers rejected him. You see, Robert committed 4 small errors. Errors that countless seniors are repeating right at this moment. He didn't realize that Plan N is not safeguarded under federal guaranteed issue rights when a Medicare Advantage plan ends. He didn't realize that the AEP, the annual enrollment period, does not apply to Medigap. He didn't realize that the 12-month trial right he held when he first signed up for Advantage had lapsed 4 years prior. And he didn't realize that in Florida, along with 45 other states, insurance companies are fully within their legal rights to refuse him a Medigap policy because of his diabetes. Today, Robert is enrolled in a different Medicare Advantage plan, a weaker one. Fewer providers in the network. His cardiologist is no longer accepted. And should he ever face a serious medical event, he is trapped. I refuse to let this happen to you, so let's unpack precisely what the law states. Here is what the federal authorities genuinely say, directly from Medicare.gov. The one-time window you can never get back. When you reach age 65 and sign up for Medicare Part B, you receive a single 6-month Medigap Open Enrollment period. Just 6 months. Within that window, no insurance carrier can refuse you. They cannot increase your rate due to your health. They cannot apply medical underwriting against you. But once those 6 months come to an end, Medicare.gov spells out the truth, plainly written. You're outside of your Medigap Open Enrollment period, so there's no federal guarantee that an insurance company will sell you a Medigap policy. That is the trap. The majority of seniors had no clue that window ever existed. And once it shuts, the door locks tight permanently across 46 states. The Medicare Advantage termination. Right now, there is Dior, federal safeguard if your Medicare Advantage plan is canceled, withdrawn, or no longer offered in your region. This is referred to as a guaranteed issue right, established under I-42 U.S. Code, Section 1395 If your plan is terminated, you receive a window 60 days before. Your coverage ends, extending up to 3 days after. It ends to apply for a Medigap policy without medical underwriting. But here's the twist that most retirees overlook. Under federal law, you are only assured access to Medigap Plan A, B, C, D, F, G, K, or L. That's the complete list. Plan M, not included. Plan N, not included. So if an agent informed you that Plan N is the most popular plan today, and it truly is, you might not be able to obtain it through guaranteed issue when your Advantage plan ends. The 12-month trial right. There is one additional federal safeguard. It's known as the trial right. If you signed up for Medicare Advantage for the very first time, when you turned 65, or if you canceled a Medigap policy to test out Advantage for the first time, you have 12 months to reverse your decision. During that single year, you can return to original Medicare and acquire a Medigap policy with complete guaranteed issue protection. But after 12 months and a single day, that right vanishes for good. DOFRS, the 4-state exception. According to the Kaiser Family Foundation, just 4 states across the entire nation provide year-round protection: Connecticut, Massachusetts, Maine, and New York. Within these states, Medigap carriers must issue you a policy no matter what your health looks like. A small group of additional states, California, Oregon, Idaho, Illinois, Missouri, Nevada, Louisiana, and Oklahoma, provide limited birthday rule windows, generally 30 to 63 days each year surrounding your policy anniversary. In the remaining 38 states and the District of Columbia, you have 0 annual protection, none at all. What triggers a denial? Here is what KFF gathered from actual insurance carrier underwriting guides. Health conditions that may result in a rejection include insulin-dependent diabetes, congestive heart failure, COPD, emphysema, history of stroke, cancer treatment, kidney disease, dementia, organ transplant, reliance on supplemental oxygen, and even merely being told by your physician to schedule an upcoming surgery or examination. These conditions are not unusual. These are the daily realities of growing older in America. DOPRS, what happens if you get denied? If you are turned down for Medigap and you stay on original Medicare without a supplement, please listen closely. Original Medicare carries no out-of-pocket maximum. None whatsoever. You are responsible for the Part A hospital deductible every benefit period. You pay 20% of every Part B service with no ceiling. Daily hospital copays beginning after day 60. Skilled nursing copays beginning after day 20. One serious medical event, one heart attack, one cancer diagnosis, one bad fall can generate tens of thousands of dollars in bills that you must cover yourself. That is the result of the Medigap trap. Now, here is what I'm asking you to do. 3 steps. Please write them down. Step 1, open every letter from your Medicare Advantage plan. Immediately every fall, somewhere between September and October, your plan is legally obligated to mail you an annual notice of change. This paperwork explains whether your plan is being canceled, adjusted, or whether your benefits are shifting. If you spot the wording, your plan will no longer be offered, or this plan is being discontinued, You have activated a federal guaranteed issue right. Do not toss that letter aside. Keep it. Photocopy it. Make 3 copies. Medicare.gov requires this letter as evidence when you apply for Medigap. Step 2. Apply for Medigap within 63 days and choose the right plan. The countdown begins the day your coverage ends. You get 63 days, not 64, not 90. 63 days. Reach out to several Medigap carriers in your state. Apply for Plan G or Plan F if you qualify. These are the most thorough plans covered by federal guaranteed issue. And here's the key point. Once you've submitted an application during the guaranteed issue window, the insurance carrier cannot turn you away and cannot raise your rate based on your health. If you feel uncertain about which plan to pick, call 1-800-Medicare. That's 1-800-633-4227 or head to shiphelp.org. For free federally funded one-on-one guidance through your state health insurance assistance program. This service is completely free of charge. Step 3. Never voluntarily drop Medicare Advantage without a plan. This is the secret error I committed to revealing at the beginning. Pay close attention. If you willingly cancel your Medicare Advantage plan during the annual enrollment period, October 15th through December 7th, you return to original Medicare. But you do not yet receive federal guaranteed issue rights for Medigap. You can be turned down, you can be denied permanently. The annual enrollment period applies only to Medicare Advantage and Part D drug plans. It does not apply to Medigap. Say that to yourself one more time. So, before you ever cancel an Advantage plan voluntarily, you must first secure written confirmation from a Medigap insurance carrier. Have the policy in your possession first, then cancel, never the opposite way around. My friend, I need you to take this in one more time. Medicare regulations are shifting more rapidly than ever before. Plans are being canceled. Insurance carriers are exiting states. And the federal protections that are supposed to shield you contain loopholes that the insurance companies understand fully and that most retirees never see. YouTube notifications are not sufficient. The algorithm chooses what you view and the timing of when you view it. By the time a critical update reaches your screen, the 63-day window may already have passed. And whenever there's a fresh alert, a deadline shift, a Medicare cancellation wave, a Social Security update, it will arrive on your phone within minutes, not days, not whenever YouTube feels like it. Minutes. The link sits in the description right beneath this video. Tap it, become a member, get the guide, and pass this video along to one friend, one neighbor, one relative who is 65 or above. Because the senior you rescue from this trap might just be someone dear to you. I am Miyu. Look after your benefits, look after your health. And I'll meet you again in the next alert.